Hello, Dr. Brandt Gibson, and today I want to talk to you about one of the discussions I had with a recent patient about types of Achilles tendon ruptures. So when you have an Achilles tendon tear, there are really three types of tears that can happen. One would be a longitudinal type tear. So instead of having a ruptures of the tendon, you have it tears along the tendon. So you have injury in the tendon or in the substance of the tendon, but the tendon itself is intact. And so you still maintain the strength, but you have significant discomfort and pain anytime you're using that tendon. Number two would be a partial Achilles tendon rupture. So you actually, again, still have tendon that's intact, but a portion of the tendon, whether it's a quarter or a half of the tendon, is torn, allowing the tendon to still move, but you have some weakness, you have significant pain, and you still have the symptoms where you feel like someone kicked you in the back of the heel or something hit you back there or whatever. And so it's a partial tear of the Achilles tendon. And the third type is a complete rupture, or complete tear of the tendon, where the tendon is completely detached, and you have a separation, an area of the tendon that is not together. So the idea is there's really those three different types. The ideal treatment for all three is the same, where you go in and you actually physically repair or surgically repair the Achilles tendon. Longitudinal tears, of course, are the easiest, and complete ruptures are the hardest. Longitudinal tears, the recovery is easier after the surgery. Complete tears, it's the hardest after surgery and usually takes the longest period of time to get back to normal. So when it comes to an Achilles tendon tear, it really comes down to, is it a longitudinal tear? Is it a partial rupture, complete rupture? And what are the treatment options? My recommendation with any type of Achilles tendon injury that you should be looking at different types of options as far as repairing that tendon. Small tears a lot of times can be treated conservatively, even with MLS laser, boot, so forth. When you start to get ruptures of the tendon, your options are reduced, and surgery is the best option, although there are some studies that show that you can actually do certain types of casting and return the individual to near normal function because of healing over a period of time, though it takes a very long time if you're going to do it through casting and limiting activities. So I do recommend surgical repair if it comes to an Achilles tendon injury or Achilles tendon rupture. This is Dr. Brandt Gibson, and this is your Podiatry Tips Day 150. Achilles tendon injuries